Good morning again, ladies and gentlemen, my fellow citizens from Randolph County. We're coming to you with our 14th meeting, our 14th video, as we continue to bring you up to date on the matters that related to the coronavirus here in Randolph County. A little cool this morning. I was heard last night that cooler right now than it was on Christmas Day for the last 2 years. So I hope this will pass and the warm summer days will be here and tomato plants are starting to grow. But we welcome you this morning. Thank you for joining us always. Susan will be along a little bit later, but our caseload continues to grow. We're up to 191 this morning, and that's Tuesday when we came. We were at 255, now we're at 291. So we're up 36 since Tuesday morning, and we did have a 5th death in the county. So continue to keep us in your prayers and continue to do those things that our health officials advise. Also this morning, I just, I guess for my little message, a little story for you, we go through this cycle. You know, we went through 9/11, 9/11, the Great Recession. All those things come in cycles, and we go back to the Bible. You remember the story of Joseph and his coat of many colors, and his brothers got jealous and sold him to the caravan, and he winds up in Egypt and through a series of events in prison where he interprets a prayer for Pharaoh's butler. And the butler subsequently goes back to work for Pharaoh, and Pharaoh has the dream, and nobody could interpret that dream. And the butler says, well, I know who can, and refers him to Joseph. And the dream was those 7 fat cows that came up, and then 7 frail and skinny cows, and they devoured the fat ones. And then there was the stalks of corn with 7 big fat plush ears, and then 7 that were burnt by the east winds. And Joseph's interpretation of that was, we will have 7 years of plenty, and then we will have 7 years of famine. And because that God gave him the ability to interpret that dream, Egypt prepared for those 7 years of famine, and they stored the grain. And of course, that led to Jacob sending his other sons down for grain, and Joseph is reintroduced to his family. But God was preparing those people for a famine. And I think he has a way of preparing us if we pay attention to him and follow those cycles. We've had good years, more people working than ever, good jobs, good pay, growth in financial markets, and we just are grateful for that. And we should never lose fact or lose sight of the fact that things can change and change suddenly. But through all those things, that God is with us and can get us through those times together. So I do have a little bit of scripture this morning that I want to share with you. And back to the Psalms again, the 107th Psalm. Probably not as well read or as much read as some of the other Psalms are, but this one I think has an appropriate message for us at this time. Oh, give thanks unto the Lord, for he is good, for his mercy endureth forever. And we find that verse or that type of scripture in various places throughout the Bible. Let the redeemed of the Lord say so, whom he hath redeemed from the hand of the enemy. And today our enemy, as we've said early on in this, we're in a war. We're in a pandemic war. And this coronavirus is our enemy. And gathered them out of the lands from the east and from the west, from the north and from the south. They wandered in the wilderness in a solitary way. They found no city to dwell in. Hungry and thirsty, their soul fainted in them. And this is a type of description of where we are today. Hungry and thirsty, their soul fainted in them. Then they cried unto the Lord in their trouble, and he delivered them out of their distresses. So we need to continue with our prayers. And he led them forth by the right way, that they might go to a city of habitation. And this is my favorite verse in this passage. Oh, that men would praise the Lord for his goodness and for his wonderful works to the children of men. And in all of these things, God has continued to be good and wonderful for us. For he satisfieth the longing soul and filleth the hungry soul with goodness. So find encouragement from these words. Continue to pray for our county, pray for our citizens, for those who make decisions that affect our county. Thank you. You will hear from Hal again today. Susan, of course, to give us an update. Mark Hensley's here this morning to provide an update on what's going on with our Senior Adult Association. So thank all of you. Have a good day. Have a good weekend. The governor's lessening up some of the stay-at-home and opening up some more businesses, those non-essential businesses. So it's a start, but a lot more needs to be done. But those things will go in effect over the weekend. And thank all of you, and God willing, we'll see you next Tuesday morning. Thank you.
Hello and good morning. I'm Mark Hensley with the Randolph Senior Adults Association, and I appreciate the opportunity to come before all of you today and share what we're doing to provide care for the senior adults of Randolph County. If you're not familiar with Randolph Senior Adults, we started providing service to senior adults in this community in 1975. We have 4 senior centers, one located in Archdale, Ashboro, Liberty, and Randleman. Plus, we have Our Place Adult Daycare. We also operate the RCATS transportation system that provides trips to any Randolph County citizen with transportation needs. We provide information and options counseling, where we're able to support and answer questions related to Medicare, and also provide support to caregivers who are caring for a loved one. In our 45th year of operation, the need for our services is only continuing to grow. Due to COVID-19, all of our senior centers closed effective March 18th. We remain closed due to the fact that we serve the most at-risk population, being senior adults, and for the fact of the governor's executive order to keep gatherings to 10 individuals or less. Since we do serve an at-risk population, we expect to be one of the last organizations allowed to reopen in this COVID virus period. Within our senior centers and our adult daycare being closed, we decided we really need to provide at least the basic services to our senior adult clients in the community. Therefore, we implemented the following items after we closed on March the 18th. RCATS transportation continues to run trips in Randolph and Montgomery County. We have not missed a single day since the COVID-19 virus hit, and we anticipate continuing to run trips Monday through Friday for the foreseeable future. We can continue to run trips through RCATS because we can control the number of individuals we put on any single trip, and therefore keep the gatherings of 10 or less in place. All RCATS drivers wear masks and gloves and are equipped with hand sanitizer and wipes. In addition, we've provided a mask to every RCATS client that's riding with us today. Our Information and Options Counseling Division continues to provide Medicare and caregiver services. We're no longer meeting in person, but we are available via telephone at 336-625-3389 Monday through Thursday daily. One of the most critical services that Randolph Senior Adults provides is our meal programs. Prior to the COVID-19, we served basically 2 types of programs with our meals. The first is called congregate nutrition. With congregate, that's where a senior adult who's 60 years of age and older comes in and has lunch in one of our centers. We also provide the Meals on Wheels program, where a senior adult 60 years of age and older who is also homebound is delivered a meal by a community volunteer. With the COVID-19 impact and the ability to be in front of individuals daily with the closure of our centers, we had to come up with a new plan because we knew that if we did not serve meals, many of our senior adult clients would go without. Therefore, we came up with the frozen meal program. We deliver 10 frozen meals every 2 weeks to all of our clients under the meal program. These are the same meals that we typically deliver hot, They are the same nutritious meals that meet USDA 1/3 daily requirements. They're simply served frozen. We've delivered 4 rounds of meals thus far, and to date we have served 16,950 meals to 1,695 senior adults since we closed on March 18th. And we will continue to deliver 10 frozen meals to every client every 2 weeks until we're allowed to reopen. We're also staying in contact with our clients. We're making daily telephone calls to determine if they're okay, how they're doing with their frozen meals, and if there's any specific item that they need at this time. In addition, when we deliver our frozen meals, we're preparing packages of information to go out to our senior adult clients. We're providing things to help them pass the day, such as word puzzles, hidden object searches, adult coloring. Plus, we're also providing information and updates on the COVID-19 virus. These packages go out every time we deliver a meal every 2 weeks. I've referenced providing masks to our senior adult clients, and that's a true community success story. We became the distribution center for a community project started by the Randolph Quilters Guild and the So Busy Ladies Sewing Group. They came up with the idea of making masks for anyone in the community that might not be able to obtain one on their own. Through donations of fabrics from Pineapple Fabrics in Archdale, fabric also from the Randolph Quilters Guild, the So Busy Ladies Group, and Randolph Health, along with elastic provided by Ashboro Elastics. In the month of April, the community made 1,200 masks. The Randolph Quilters Guild and the So Busy Ladies Group would take the fabric, the elastic, and they provided instructions on how to assemble the mask. And these were put into kits. Each kit would make 20 masks, and they were available at the Ashboro Senior Center. We've had individuals that come in, pick up kits, take them home, create their 20 masks, and then return them to us for distribution. This process or project started in March, and to date we've delivered masks to Randolph Health, the Randolph Cancer Center, assisted living centers, and other areas in the community, in addition to all of our senior adult clients receiving a mask as well. Our goal in May is for another 1,000 masks to be created and distributed. So if you would be interested in creating 20 masks out of a kit, come by the Ashboro Senior Center and pick the kit up and then return it to us when you've completed your work. This is truly a community project for the community. Lastly, you may be wondering why our meal volumes are increasing. First of all, Randolph County is an aging population. I would also mention that the Randolph County Strategic Plan released in 2016 said that between the years 2016 and 2031, that 99% of our population growth would be 65 years of age and older. Think about that. 99% of our population growth would be in the senior adult demographic. Before COVID-19 hit, we were already experiencing significant increases in requests for meals. If you compare this fiscal year with last fiscal year, we were already up 20% before COVID-19 hit. Last fiscal year, we served about 75,000 meals in Randolph County, which is about 6,300 meals per month. Through the first 8 months of this fiscal year, we were on pace to do 91,000 meals, or about 7,600 per month. However, in the month of March, the first month that COVID-19's impact was felt, we served 10,500 meals, which is a new record in terms of volume for Randolph senior adults. As we continue to tabulate our results for the month of April, we anticipate what we served in April to be in the 12,000 meal range. If you need more information about our meal programs, please go to our website at www.senioradults.org. As we are saying here at Randolph Senior Adults, the COVID-19 has not stopped our seniors' need for nutritious food, and we haven't stopped serving. I'd like to say a special thanks to our community partners, organizations such as Randolph County, our local municipalities, the United Way of Randolph County. The list goes on and on. We also receive great support from individuals and volunteers who support Randolph Senior Adults. Without all of these organizations and individuals, we could not provide the services to our senior adults in Randolph County. So what can we do? What can I do to support senior adults within the community? First, offer to volunteer. Second, make a donation to help offset the rising meal costs in our community. Pick up the phone and call a senior adult relative or a senior adult that lives in your neighborhood. A call at this time would mean the world to a senior adult. Continue to pray for everyone's safety during this pandemic event. Pray for our community and pray for our elected officials. I want to say, please take good care of yourselves and stay safe. Thank you.
Hi, I'm Susan Hayes, Randolph County Public Health Director. Our positive case count today is 291. Sadly, we've had another death this week. That brings our total to 5. On May 5th, Governor Cooper issued an Executive Order 138. The order goes into effect tomorrow, May 8th. The order moves North Carolina as well as Randolph County into Phase 1. So what does that mean? What is different about Phase 1? Phase 1 does the following. It eliminates the distinction between essential and non-essential businesses. It allows most retail businesses, with just a few exceptions, that can comply with specific requirements to open at 50% capacity. It also allows people to leave home for non-essential goods and services. It encourages state parks and trails that were closed to open. Specifically allows people to gather outdoors while following recommendations to remote social distance and reduce transmission with up to 10 people. It also opens child care providers to working families and encourages North Carolinians and Randolph County residents to wear cloth face coverings when outside the home to protect those around them. What stays the same in Phase 1? Our stay-at-home order remains in place. It continues to limit, for the most part, mass gatherings to 10 people. Teleworking is encouraged. Social distancing, hand hygiene, and other methods to slow the spread of COVID-19 should be practiced, including staying at least 6 feet apart from others. Restaurants and bars remain closed for dine-in service and on-premises beverage consumption. Remember that Mandy Cohen and Governor Cooper also ask us to know our W's. What are they? They're wear, wait, wash. Wear a face covering when you're out for those goods and services, and you know you can't social distance or stay 6 feet away from others. That's how you protect those around you. Wait at least 6 feet from others when you're out. And wash your hands. We can't say that often enough. Wash, wash, wash. Those are the things that we know science tells us: social distancing, staying away from folks at least 6 feet, and washing our hands, and hand sanitizer, and sanitizing frequently touched surfaces. Those are the things we know will work. So remember to wear, wait, wash. Thank you.
Thank you, Mark, for that excellent update on our Randolph County Senior Adults Association and the services you are continuing to provide during this coronavirus pandemic. And thank you to the staff and the many, many volunteers that are working together through our Senior Adults Association to ensure that our seniors are safe and remembered during the community shutdown that's been caused by this pandemic. As of today, Randolph County has produced 14 videos designed to provide our citizens with up-to-date information on the status of the coronavirus pandemic. Our videos are also designed to provide you with information regarding how your Randolph County government and our agencies and organizations are working together and operating to ensure continuity of services during these challenging times of coronavirus pandemic. Information in a crisis can be a citizen's most valuable resource. To date, these YouTube videos have generated over 18,000 views, not counting shares, and we thank you for that. Our next video will be next Tuesday, May the 12th, and they're usually posted on the Randolph County website around 1 p.m. Thank all of you again for spending time with us today, and please stay safe as we continue to face these challenges together as a Randolph County community.